Hi, today's Ask the Expert question is, what causes asthma? And we have a pulmonary critical care physician on the set, Dr. Ming-Ming Lee. What causes asthma, and maybe, how do we approach treating it too?
Yes, so what causes asthma? It's essentially chronic inflammation in the airways that cause asthma, and because of that, the airways are always a little bit narrowed and can be what we call hyperreactive in response to certain triggers. So for example, would be allergens, cold air, strong odors, viruses, colds, exercise.
So it doesn't have to be an infection. It can be something mechanical or something even allergic or irritating for that matter.
Exactly, yes. And what we do to manage it is basically the principles are avoidance of the trigger, so sort of identifying what makes your breathing worse and avoiding that. Taking your controller inhaler medications as prescribed by your physician, as well as going to regular doctor's visits.
When you say taking your controller medicines, means taking them whether or not you're having symptoms.
Yes.
It's not an as needed, largely, I shouldn't say, but most of the time it's a regular therapy.
That's a really important point. I think people don't realize that it's a maintenance medication, meaning that you take it every day, whether you feel good or not.
And then don't you modify the medicines when people have an asthma exacerbation?
Yes. So if people come in with an asthma exacerbation, we may increase the amount of inhaled corticosteroid that they're taking to try and reduce the inflammation. And then if needed, we'll prescribe a short course of prednisone as well, which is an oral steroid.
And doing all that, most people should do pretty well with asthma, shouldn't they?
Yes.
Which is the good news. Well, the bad news is it's a rotten disease, but the good news is we can manage it pretty effectively.
Right.
And remember to share your questions and comments with us by calling us at Community Relations at New Vance Health. Our number is 203-852-2250. We'll see you next time.